Jaundice, we have pathological and physiological jaundice. Pathological jaundice is like jaundice that is detected after 24 hours of life, and serum bilirubin rise by more than 5 mg per deciliter per day, and serum bilirubin of more than 15 mg per deciliter. Like in the first day, the serum bilirubin is 5 mg, and then the second day is 10 mg, and the third day is 15 mg, like that. And then clinical jaundice, like with persisting more than 2 weeks of life, and have a dark urine stains or clay colored stools, and then direct bilirubin of more than 2 mg per deciliter at any time, we consider them as pathological jaundice. And physiological jaundice is like the jaundice that appears between 24 to 72 hours of age, and the serum bilirubin level peaks by third day of life, and falls in, and then it falls in term neonates. There's something called as breastfeeding jaundice that occurs between 24 to 72 hours of age and peaks by 5 to 15 days of life, and it is related to inadequate breastfeeding. So ensure optimum breastfeeding. And there is something called as breast milk jaundice. The breastfeeding jaundice resolved by third week of life, and if more than 3 weeks of life the jaundice is present, we have to look for breast milk jaundice. And There is clinical estimation by Kramer dermal staining of bilirubin. We have 5 zones. Zone 1 is at the forehead of skin of the forehead, and zone 2 is chest and the abdomen, and zone 3 is lower abdomen and thighs, and zone 4 is legs and arm, and 5 is palms and soles. In zone 1, the total bilirubin is like approximately 4 to 6 mg per deciliter, zone 2 of 6 to 8 mg per deciliter, and zone 3 of 8 to 12, and zone 4 of 12 to 14, and more than 15 hours of in zone 5. And Total serum bilirubin can be assessed by transcutaneous bilirubinometer handheld device. Then yeah, phototherapy. It acts by converting insoluble bilirubin to soluble one that can be excreted in urine and feces. The types of phototherapy lights are blue, green, and the shapes are like straight or U-shaped. U-shaped is commonly referred to as compact fluorescent lamps. Nowadays, commonly we are using that, and high intensity LED lights, and fiber optic light also. Phototherapy acts in several ways, like configuration isomerization, structural isomerization, and photo oxidation. Mm, the radiance of phototherapy light should be periodically measured, and a minimum level of 30 microwave per centimeter square in the wavelength range of 460 to 490 nanometer must be ensured. And The baby should be naked, except baby can wear diapers, and to cover eyes, goggles should be provided, or any eye patch. We have to make sure that it doesn't block the baby's nostrils, and put the naked baby under the light in a cot or in a cot. If a baby is more than 2 kg or an incubator on radiant warmer, if the baby is small, less than 2 kg, keep the distance between baby and light up to 30 centimeter distance, and ensure the optimum breastfeeding. Mm, Discontinue phototherapy once the total serum bilirubin level 12 hours apart has fallen below the specific values. And then exchange transfusion is done when the cord bilirubin is 5 mg per deciliter or more, or when the cord hemoglobin is 10 gram per deciliter or less.